Hi everyone, in this video we are going to study the appendicular skeleton along with the girdles. And the appendicular skeleton are the limbs in our body, and we are going to look at the specific features of each appendicular skeleton. Once we get to the pelvic girdle, we are going to differentiate how to tell the difference between a biological male versus a biological female pelvic girdle. In addition to that, we are going to also differentiate the difference between the bones in your hand and in your foot. So before we actually start going through all the features of each bone, I want us to just overall do a brief overview of the bones that we will be studying. So moving from the superior to the inferior view, we have the clavicle right here. This is our collarbone. And if you take a look from the posterior view, this would be the scapula right here. And moving downward, this is the humerus, which is the bone of your upper arm. And since this skeleton is in the anatomical position, you can see that the hand is facing with the palms facing forward. So the bone that attaches to the thumb, that is called the radius. And the radius would be on this side, it's attached to the thumb here. And the ulna is the bone that attaches to the pinky. So this is the ulna here. Then we have our pelvic girdle. In the middle, this is where the pubic bone meet and it forms an arc, which is the pubic arc. And then we have our hands. And this right here is the longest bone that we have in our body. This is the femur. And then we have the patella, which is our kneecap. And this right here are the two long bones of the lower legs. So we have the tibia, which is the bigger one, and then the fibula, which is the smaller one on the outside. So anytime you're given this diagram, the tibia is always going to be more medial if the person is standing in anatomical view, and the fibula is on the lateral side. And then here we have our feet. Okay, so now let's go ahead and take a look at the scapula. And if you see from this diagram right here, the scapula is more visible from the posterior view of the body. I want to start first by going over the three borders of the scapula. So if you take a look at the scapula from all angles, you can see that there are three borders. So the first border right here, let me highlight it. Okay, so first of all, before we actually get into the border, it's important that you differentiate between the right and the left scapula. So from the posterior view, you can see that the spine is visible. So this right here is the spine, and the spine is most visible. Well, it's actually only visible from the posterior view. Now, if the spine is pointing to the right side, this right here would be the right scapula, and I'm showing you the different views of the scapula. So you can see here that the spine is pointing to the right side, so this is the posterior view of the right scapula. On this side, the spine is pointing to the left side, so this is the posterior view of the left scapula. Now, from the anterior and posterior view, from the anterior view, okay, this is again the right scapula that I'm showing. From the anterior view, this right here would be the medial border. Okay? So the medial border is the border that is facing the midline of your body. So from the anterior view, this would be the medial border. Your right humerus is going to attach here. So this is the medial border from the right anterior view. From the back, this then would be the medial border. So you can see here, this would be the medial border of the right scapula from the backhand side. Okay, so if this is the medial border, then this would be the lateral border. The lateral border is going to be facing the external, the side part of our body. So we have the medial and the lateral border. And then up here, we have the superior border, and the superior border would be right here on the posterior view. Okay, and then the lateral border would be right here on the posterior view, and this would be the medial border. So now, since we finished talking about the borders, let's go ahead and take a look at the angles. There are also three angles. you have the superior angle right here. Then down here, you have the inferior angle. And then on the anterior view, from the lateral side, you can see that this is the lateral angle. Okay. All right, so if we take a look at the posterior view, okay, this would be the superior angle, this would be the inferior angle, and this would be the lateral angle from the posterior view. Okay. All right, let's go ahead and clear all of that off. And let's move into other anatomical position features of the scapula. So from the back, as I mentioned before, this is the spine. In this posterior view, the spine is facing to the right-hand side. So this is going to be the spine of the right scapular, and this is the posterior view. Now you can see that the spine, it's going to extend out into this process right here. This is the acromion process. You can see the acromion process from the posterior view and also the anterior view right here. From the lateral view, this would be the acromion process. So this is the acromion process here, here. It translates to this part right here and this part right here in this articulated scapula. And then if you tilt the scapula so you're looking at a side profile, this would be the acromion process right here. Okay. So now going back to the posterior view, since this is the spine, okay, above the spine, you can see the fossa right here. Since this is above the spine, this is called the supraspinous fossa. And then below the spine, this entire area right here is called the infraspinous fossa. Okay. And going back to the acromion process, we'll see later that the acromion process is going to articulate with the clavicle. And you can see right here, the acromion process, it is connected to the clavicle, the collarbone. And what it allows you to do is have mobility in your arm movement, specifically up and down movement, because it attaches at a joint here called the acromial clavicular joint. Okay. All right. So then again, this is the spine, and you can only see the spine from the posterior view. So the spine actually extends up and end at the acromion process. So the interesting thing is that your trapezius and your deltoid muscle attached here, and the trapezius and your deltoid muscle help well, specifically the trapezius muscle, it helps move the scapula, and the deltoid muscle, it helps move the humerus, and it attaches here at this region. All right, so now let's go ahead and look at the scapula from the anterior view. So in the anterior view, again, you can still see the acromion process, but now in the anterior view, you can see the coracoid process. Again, any process is an extension. So the coracoid process is found in the anterior view here, and it's also seen in the lateral view. So this is the coracoid process. And what we can also see here is the this right here is a cavity, but it's not so deep, so it's also known as the fossa. So this is the glenoid cavity, also known as the glenoid fossa. And you can see it here as well in the posterior view, and you can best see it in the lateral view. This is the glenoid cavity, also known as the glenoid fossa. Now this is the area where the head of the humerus is going to attach to here. And another thing that I want to focus to with the glenoid cavity is that above the glenoid cavity, this is called the supraglenoid tubercle. And the supraglenoid tubercle is going to attach to the long head of the bicep muscle. And then below the glenoid cavity, this is going to be the infraglenoid tubercle. So again, you have the supraglenoid tubercle and the infraglenoid glenoid tuberculi, and this is where the long head of the tricep muscle is going to attach. And going back to the coronoid process, which is right here, and the coronoid process, which is right here, again, process, like I mentioned before, is any extension. So the muscles that attaches to the coronoid process, this is going to be your pectoralis minor, the short head of the bicep brachii, and the coracoid brachialis muscles. So keep those muscles in mind. Once we learn about those muscles in more detail, they are going to be attached here to the coronoid process. Now, let's go ahead and go back to the anterior view. So in the anterior view, again, we can see the glenoid cavity, we can see the coracoid process, we can see the acromion process. Some other things that we have not seen yet is that this entire concave surface on the anterior view, this is where your rib is going to travel through. So this entire area right here is called the subscapularis fossa, and it covers this whole entire front portion of the anterior portion of the scapula. And then moving up here, we can see that there's a tiny notch. This is the suprascapular notch. It's more visible from the anterior view. And this is where all the suprascapular ligament, artery, and nerves are going to run through. They're going to run through this tiny notch right here. Okay? So again, as a review, for the scapula, if you want to identify whether it's the left or the right scapula, first, before you even do that, take a look at whether you can identify the anterior or the posterior view. In the posterior view, you can see the spine. If the spine runs to the right side, then you're looking at the right scapula. If the spine runs to the left side, then you're looking at the left scapula. And then you can apply the terms to whichever scapula you're looking at. Make sure you can identify and differentiate between both the left and the right scapula. I showed you the right here, but make sure you can also identify the features on the left scapula as well. All right, now let's go ahead and take a look at the clavicle bone. The clavicle bone is also known as your collarbone. And with your collarbone, it is going to have two ends. One end is attached to the clavicular notch to the sternum, so that would be the sternal end. And remember, the other end is going to attach to the acromion process of the scapula, so that would be the acromial end. Now, when you're looking at the clavicle, first, in order for you to identify whether it is the left or right clavicle, you need to understand the different orientation of the clavicle to begin with. So this is looking at the clavicle from the superior view. So if you're looking at a bird's eye view down, this is what it looks like. And this is the right clavicle, as you see here. The anterior view is looking at it from facing the person looking at their face. So this is the anterior view. The inferior view is looking at the bottom portion, is looking at the bottom up. So when you have a clavicle bone, take your hand and feel the divots and the indents in the clavicle bone. So on the bottom part, in the inferior region of the clavicle bone, there is this protrusion right here. It's this bony part called the coronoid tuberculi. So this is a small bony prominence, and it's located only in the inferior surface of the clavicle. Okay, and it's going to be located more to the sternal end. Then you also have this other impression here. So this impression that you see here is not very smooth. This is the impression for the costal clavicular ligament. This is going to be closer to the sternal end. So you find the bump and you find the impression on the inferior end. On the superior end, you're not going to have that. You're not going to, that's not going to be visible. So that's first how you identify whether you're looking at it from the superior or the inferior view. Once you differentiate that, then you can flip it to the superior view, And the end where it is more flat, or as flat as it could be, that is going to be the sternal end, and that's going to attach to the sternum via the clavicular notch. And then the more rounded part, that is going to be the acromial end, and that is going to be attached to the acromion process of the clavicle. So again, you do have to differentiate between the left and the right clavicle. This is just showing you the right, and you have to know whether it's the inferior or superior view. So my recommendation is first identify the superior and inferior portion of the clavicle first, just so you can orient it in the right direction, and then look at the ends and determine where is the sternal and where is the acromion end, and then put that all together and you can determine whether you have a right or a left clavicle. All right, so now moving into the bones of the arm. In the upper arm, which is shown here, this is going to be the humerus. The humerus is the principal bone of the arm, and it's going to articulate to two different areas. The proximal end of the humerus is going to articulate proximally with the scapula at that glenoid cavity. It's going to form a glenoid-humeral joint, and this right here allows you to have a wide mobility in your shoulder, allow you to rotate your shoulder. At the distal end of the humerus, this is going to articulate with the radius and the ulna at the elbow joint. So now let's go ahead and take a look at the humerus. Here I'm showing you the right humerus from both the anterior and the posterior view. You have to also understand how to tell the difference between the right and the left humerus. So the first thing you want to notice is that in the anterior view, there's going to be these two divots. These two divots right here tells you that it's in the anterior view. And if the head of the humerus is pointing medially, this is attaching to the right scapula. Now, it would be vice versa on the left humerus. In the left humerus, you can see the two divots in the front, the two fossa here. But the head of the humerus is going to point to the other directions because it's going to attach to the left scapula. Okay. In the posterior view, there's only one divot. So that is one way you can tell the difference between the left and the right humerus just by looking at it. Okay. So the anterior view has the two divots. The posterior view has the one divot. Now let's go in and talk about the names of these divots and the features. So this rounded area, that is the head of the humerus, and it's going to attach to the glenoid cavity at the glenoid-humeral joint. So this entire thing is the head. The anatomical neck is right underneath the head. So this is the anatomical neck right here. And then you also have the surgical neck. The surgical neck is this area right here. And the surgical neck is essentially the circumference. There's going to be axillary nerve that wraps around the back of the surgical neck, and fracture in the surgical neck may also damage the axillary nerve, which is the nerve that runs through your armpit. And then you can see that there are two bumps. So tubercle is the name for the bump. You have the bigger bump here, so this is the greater tubercle, and then the smaller bump is the lesser tubercle. From the posterior view, you can see that the greater tubercle extends to the posterior view as well. So the greater tubercle, remember, that's going to be the larger one, and it's the one that's found on the lateral side. And the greater tubercle is the attachment sites for our rotator cuff muscles, the supraspinatus, the infraspinatus, and the teres minor. So those are three of the rotator cuff muscles that we have. The lesser tubercle is going to be attached to the fourth rotator cuff muscle, which is the subscapularis muscle. And we'll go through the name of these muscles once we get to the muscle labs. All right. And then if you can see in between the tubercle, there is going to be the sulcus, which is this groove right here in between the greater and lesser tubercle. So the intertubercular sulcus is this groove that you see here, this indent. And then in the front view of the humerus, you can see that there's this bony bump. This right here is the deltoid tuberosity. This is where the deltoid muscle is going to attach. Now, the deltoid tuberosity, you can still see the bump on the posterior view as well. Now, on the posterior view, there's also this other groove that you see here. This other groove is called the radial groove, is also called the radial sulcus as well. And in addition to that, because it's sort of spiral, this is where a lot of spiral fracture occur. It's also called the spiral sulcus and also the spiral groove. Okay, so the radial nerve actually runs through here. So anytime you have a spiral fracture, this can actually injure the radial nerve, which is the nerve that sends signal to your thumb. So that is only found in the back portion in the posterior view. So this is the radial groove, also known as the radial sulcus. It's also known as the spiral sulcus or the spiral groove. Okay. All right, so now let's move down to the lower part of the humerus, the distal part. So in the distal part of the humerus, you can see right here that there's this hinge. This hinge area is called the trochlea, and you can also see it from the back portion as well. The trochlea forms a hinge joint where your elbow is going to attach. And then on the lateral side, you have this rounded portion. This right here is called the this is called the capitulum. The capitulum is the other head of the humerus. So you have the main head on the top, and then you have the capitulum right here in the distal on the distal view. This right here, the capitulum, is going to articulate with the radial head of the radial bone. So right here, you can see that this is the radial bone. The radial head is going to articulate with the capitulum right here. And on this side, you also have another rounded protrusion. So condyle is also known for a knob or a rounded end. So in the medial view, in the midline, so in the medial portion of the humerus, you have the medial epicondyle here. And the ulnar nerve is going to travel here and send sensation to the pinky. So this is the medial epicondyle here. In the posterior view, this would be the medial epicondyle. And then on the lateral view, this rounded projection right here next to the capitulum, this is going to be the lateral epicondyle. So the lateral epicondyle is going to be on the lateral side. Now, from the anterior view, you can see that this divot, remember in the anterior view, we have two indents. This indent right here is called the coronoid fossa. The coronoid fossa is the indent in the front, and then this on the lateral side, this is going to be more on the lateral side. This is called the radial fossa. The radial fossa is more on the lateral side, and the coronoid fossa is more on the medial side. There are two fossa in the anterior view. In the posterior view, there's only one fossa. So this is called the olecranon fossa. It's the indent in the back. So if you take your elbow and you extend your elbow all the way to the back, this is called the elbow flexion. What you see here is that the bone of your ulna, which is the lower bone right here, it cannot flex all the way back because the olecranon fossa stops it at a certain point. So this prevents hyperextension. Now, if you were to flex your elbow, so like a bicep curl, if you flex your elbow, then the bones of the ulna is going to come into more contact with the coronoid fossa in the front. So whenever you're flexing, the ulna move closer to the coronoid fossa, but when you extend your elbow, such as doing a tricep curl, you can see that the bones of the ulna is going to come into contact with the olecranon fossa more, and you cannot hyperextend your arm because, again, it can only go so far right here. Okay. All right, and that is all the features of the humerus bones. Now let's go ahead and move distally, or you can think of downward, to the bones of the lower arm, which is going to be the radius and the ulna. All right, so here you can see that we're going to do the radius and the ulna both at once because they are next to each other and they are going to articulate together, and they are connected. Well, the ulna is connected to the humerus. So what you see here is, again, the right radius and the right ulna. Make sure you can take this information, these features, and apply it to the left radius and the left ulna. So this right here shows you that the ulna is articulating with the humerus, and at the distal end, you can see it articulating with the bones of your hand. So in an anatomical position where the person is standing up straight, standing up, and the palm is facing in front, facing the person that they're looking at. The ulna is the bone that is connected to the pinky, and the radius is the bone that's connected to the thumb. So you can think of the word radius. It starts with the letter R. When someone does like a radical, when people serve, they stick out their pinky and their thumb, and they're like, that's so rad. So think of the radius, it goes to your thumb. And then the ulna starts with the letter U, it goes to the pinky, so you can think of it as PU. When something is stinky, you say, oh, PU. So that's one way that you can remember it. Okay, excuse me. All right, so let's go ahead and talk about the ulna. So the ulna is going to be this bone right here. And the ulna, if you take a look at it where it's not articulating with anything, you can see that it forms like a U shape here. Sorry. It forms like a U shape here. So that's how you can that's how you can tell that it's the ulna. Okay. All right. So actually, let's go ahead and talk about the radius. So that's another way you can differentiate between the radius and the ulna. Let's go to the radius. So the radius is the bone that is going to articulate with the thumb side. So the flat part of the radius, this is called the head of the radius. So the radius has that flat part. And then there is a bump. The bump on the radius, that's more on the superior, more on the proximal end, that is called the radial tuberosity. And this is where it's going to be the point for the ulna attachment, but specifically the insertion of the bicep brachii is going to attach here right at the radial tuberosity. And then moving down, you can see that there's this tip right here. This tip is called the styloid process. We've seen the word styloid before. Styloid means pen. It means specifically the tip of the pen. So anytime you see a tip, there should be the word stylus. And this is the styloid process of the radius, because there's another styloid process of the ulna, as we'll see later. So this is the styloid process of the radius. And then right here, this tiny notch in the radius, this is called the ulnar notch of the radius, which is where the ulna is going to attach to. Okay, so those are the features of the radius bone. Let's move into the ulna. So again, this is the ulna from the anterior view, and you can see that this portion of it forms like a U. So this portion is going to hook into the humerus, and from the posterior view you can see the back hook in more detail. So this area right here is called the olecranon process, of the ulna, and see how it attaches to the olecranon fossa of the humerus, and this is from the posterior view. And then also, when the ulna is articulated right here, you cannot see the trochlear notch, but this open area where I said it's a U earlier, this is the trochlear notch. This is the attachment site as well. So this is where it sits with the humerus bone. So this right here, this is the olecranon process, and the notch, the actual divot, which you see here, that is called the trochlear notch, where it's going to combine with the hinge of the trochlear that we saw earlier from the humerus. So remember, this is the trochlear of the humerus. It is going to be supported by trochlear, the trochlear notch of the ulna. And then moving a little bit down, you can see here, this is the radial notch. This notch here in the this is the this is the radial notch of the ulnar bone. So it's called the radial notch of the ulnar bone because this is where the radius bone attaches to. And the let's see, yeah, it attaches to. There's also going to be ligaments that come through the radial notch of the ulnar bone as well. Okay. And then we are going to move down into here. Oh, and then also this portion, this where this arrow is pointing to here and here. I know it's a little bit hard to see, but this area right here, this is the coronoid process. The coronoid process serves as a hook for the brachialis muscle. So whenever the brachialis muscle is attached to here, this also allows you to flex your elbow. So to differentiate that a little bit more, the olecranon process is right here. You can see it more from the posterior view. And then the actual area where the trochlea of the humerus sits on, that is the trochlear notch, and it's best seen in this view with no articulation. And then surrounding that trochlear notch is the coronoid process, and this process right here allows for the attachment site for that brachii muscle. So the brachii muscles is going to attach right here at the coronoid process. Okay. Now we can actually move down, and interestingly enough, in the distal region, this is actually the head of the ulna. So the head of the radius is up here, but the head of the ulna is down here in the distal region. So this is the head of the ulna, and then you can see here that the ulnar notch on the radius bone, this is where the ulna is going to attach to here. And then there's also a tip on the ulna. So this tip is the styloid process, but it's the styloid process of the ulna bone, and this is where the ligaments of the wrists are going to attach to at this styloid process of the ulnar bone. Okay? And again, that is the radius and the ulna of the right side of our body. Make sure that you can take this information and apply it to the left radius and ulna as well. All right, so now we're going to move into the bones of the hand. Now, this is the diagram that you have in your worksheet. Right here, many students get confused and they think this is the left hand, this is the right hand. These are actually both the right hand, but you're just looking at it from different view. This is your right hand, but it's your palm view. So your palm facing up here. And then if you take your hand and you tilt it, you flip it over, this is the dorsal view. So this is actually the back of your hand. Now, how to differentiate between the palmar and the dorsal view is that in the palmar view, in your thumb, there's going to be these two divots that come out. And these two divots are so these two divots that you see in the metatarsal, the metacarpals, it's only visible, it's more visible from the palm view. So that's how you can tell whether you're looking at the palm or the dorsal view. And then from there, you can differentiate whether you're looking at the left or the right hand. So only in the palm view, so when the palm of your hand is facing up, can you see these two divots in the metacarpal one. All right, so since that's a little bit confusing as of the moment, I do want to show you how it actually looks like when you have the actual features, the outline of the hand. So this right here is showing you the dorsal view. Notice in the dorsal view right here, we can't really see that pivot clear as we see in this one. So in the dorsal view, which is the dorsal view right here, this is what we're actually looking at. Okay. Now, this is showing you the right hand, okay? And again, we're going through the right hand, but I also want you to be able to take this information and apply it to the left hand as well, okay? So in the right hand with the dorsal side down, you can see that you have 3 different bones in your hand. So in your hand, you have the carpal bones right here. So this is the carpal bone. The carpal bone is composed of 1, 2, 3, 4, 5, 6, 7. There are 7 bones in the carpal bones, and we're going to go through the name of those bones in a bit. And then up here, you have the metacarpal bones. There are 5 metacarpal bones. You number it from the thumb going out. So this is metacarpal 1, 2, 3, 4, and 5. And then up here, moving distally from the metacarpals, you have the phalanges. Now, with the phalanges, there are 3 types. There's the proximal phalanges, which are the closest to the metacarpals. There are 5 of them. So you name it from the thumb going out. So 1, 2, 3, 4, 5. The middle phalanges, there's none in the thumb because the thumb is the shortest digit. The middle phalanges are only going to start with number 2, where your index finger is, and ends at 5. So the middle phalanges, 2, 3, 4, 5. There's no 1. The distal phalange, there are 5. So the distal phalange is all the way at the end of the digits. It starts with 1, 2, 3, 4, and 5. So the middle phalange, the middle phalanx, there's none in the thumb. It starts at the index, and since there's none in the thumb, we start with the number 2. So 2, 3, 4, and 5. Okay. All right, so now let's move on and talk more about the bones in the carpals. So there are going to be 7 carpal bones that you have to remember. So 1, 2, 3, 4, 5. Sorry, 1, 2, 3, 4, 5, 6, 7, 8. I apologize. There are 8 carpal bones. Okay. Now, with these 8 carpal bones, we're going to start with the one that is closest to your thumb. So with these 8 carpal bones, we have the scaphoid right here. Then we have the lunate. Then we have the triquetrum right here. And then the triquetrum is actually pretty unique because there's going to be another bone that extends from the triquetrum, which is called the pisiform bone. But the pisiform bone is more visible from the palmar view. So if I show you the image of the bone in the palmar view, you can see that right here, this is the pisiform bone. All right, and then up on top, this is going to be called the trapezium. Moving next to it is the trapezoid. Then we have the capitate, and then we have the hamate. So going again, starting from right to left. This is the scaphoid, this is the lunate, this is the triquetrum, and then it's also known as the triquetral, but again, if you write whichever name, I'll accept it, but triquetrum is also is the name that a lot of people use. And then the pisiform bone, it's going to be extending from the triquetrum, and it is found more on the palmar view. So this right here is the pisiform. Okay. Now on top, this right here is the trapezium, trapezoid, capitulate, and then the hamate. So you can find some mnemonic to study this. One mnemonic is Sally left the party to take Kathy home. So Sally left the party. Remember, the P in party stands for the pisiform. To take Sally home. That's a mnemonic that you can use to study as well. Okay. Now let's go ahead, since this is a little bit confusing, let's study this from the left hand side. Okay. So from the left hand, you can see that this is the dorsal view and this is the palmar view. So this is the left hand here. So dorsal and palmar view. Okay. Now you can see here that now we are looking at the orientation a little bit different because the scaphoid is going to be pointing to the thumb. In the previous, remember the scaphoid is always the one that is closest to the thumb. So now it goes from scaphoid, lunate, triquetrum, or triquetrum as some pronunciation go. And then on the palmar view, you can see extending from the triquetrum is the pisiform, which is right here. All right, so scaphoid, lunate, triquetrum or triquetrum, pisiform, and then you have the trapezium, trapezoid, capitulate, and hamate. Okay, so Sally left the party to take Kathy home. So let's go over these bones in a little bit more detail. Again, this right here is looking at the left hand dorsal view, and then left hand palmar view. So the scaphoid is the bone that is most commonly fractured whenever you have a carpal fracture, such as falling and using your wrists to balance yourself to stop the fall. It's usually the scaphoid that is the one that is cracked. The lunate is a bone that's in the proximal row, and it leads to acute any type of carpal tunnel syndrome when it's fractured or dislocated. The triquetrum right here, the triquetrum, the etymology for this bone, it means three corner, and the quadritrum, the triquetrum or triquetrum is also like the scalpel. It's also the bone that is almost most commonly injured as well. It's the scaphoid first, and it's also the quadritrum. If you land and you use your wrist part to the other side of your hand, your wrist part, to stop your fall. The pisiform is not involved really in the movement of the wrist. The the trapezium bone right here, this is the one that allows you to really rotate your carpal bone, and it's a lot for it's really involved with the thumb movement, the trapezium bone. If you take your hand and you go ahead and just rotate it, a lot of that pressure is put on the trapezium bone. The trapezoid bone right here, this is four-sided, and it translated to the word trapezoid, but here trapezium means that it's an irregular quadrilateral. And then, yeah, so that's an interesting thing. And then you have the capitulate right here, which is actually the largest bone in all the carpal bone. And then finally, you have the hamate bone as well. This is a bone that is commonly fractured as well. You see fracturing in this bone in golfing, in baseball player, and sometimes if it's too much of a fracture, people can volunteer to actually have this bone removed. So that's the hamate. Okay. All right, so those are all the bones of the hand. Make sure you can differentiate whether you're looking at a palmar view or a dorsal view. Remember, the palmar view, you can see the pisiform, and make sure you can tell the difference between the left and the right hand. All right, so now we're going to look at the pelvic girdle. The pelvic girdle is essentially two oxcoxae bone that join together right here at the pubic symphysis, and it forms this pubic arc. Okay. So remember, these two oxcoxae bone are essentially your hip bone, and they're going to articulate with the sacrum bone that we studied before. Now, when you see this opening right here in the pelvic girdle, you can actually differentiate whether you're looking at a male or a female pelvic girdle. The female pelvic girdle is going to have a much more rounded opening to support childbearing. So this right here is actually the female, and this is the male pelvic girdle. And interestingly enough, if you take a look at the bone anatomy of someone, they can actually even determine whether the female has given birth before, or has been pregnant before, just looking at the wider circumference of the pelvic girdle. So now we're going to learn about the os coxae bone. So there are two os coxae bone. They are your hip bones that are joined from a fusion of three bones. So again, you have the right os coxae and the left os coxae. They're joined together at the pubic symphysis, and this is the pubic arc right here. So now let's switch over to a live view, and I'll show you the os coxae and all the features of the os coxae. All right, hello everyone. Now we are going to look at the hip bone. The hip bone is the os coxae bone here. Now I want you to understand the orientation of how it fits in with the sacral bone that we learned about before. Now I only have the right hip bone. So this is the right hip bone right here. This is looking at the body bones from the anterior view, and see how it connects with the sacrum bone. So we're going to focus our attention to the os coxae, which is the hip bone. Now this is the anterior view of the os coxae. So this is the anterior view and this is the posterior view. And to remind you, this is how it fits in with the sacral bone. And there's going to be a left hip bone, but we just don't have it as of the moment. Now, when you're studying the os coxae bone, we study it from the lateral and the medial view so we can see the fusions of the three bone. So I'm going to go ahead and tilt this to the lateral view. So you can see this is the lateral view. This is how you would see it from looking at the side profile of someone. And remember, this is the right os coxae. The tapes here is to mark the fusion of the three bones. The os coxae comes from the fusion of the ilium, the ischium, and the pubic bone. Okay, so again, this is the ilium, the ischium, and the pubic bone. Let's go ahead and focus on the ilium first. And this again is the side profile. This is a lateral view. Only in the lateral view can you see the acetabulum. The acetabulum is where the head of the femur attaches to. So the head of the femur attaches to the acetabulum right here. And then this opening is the obturator foramen, this opening right here. So again, this is a lateral view. This is the acetabulum. This is the obturator foramen. So even though we're looking at this from the lateral view, hopefully you can still understand that this is the anterior and this is the posterior. To reorient you, this is how it fits in. Okay, so this is the lateral view if we tilt it to this side, and this would be the anterior view, and this is the posterior view. So in the ilium, there are four spines, 1, 2, 3, 4. This spine right here, since it's in the anterior and it's on top, this is called the anterior superior iliac spine. This spine on the bottom is the anterior inferior iliac spine. On the back, on the posterior side, it's going to be the posterior superior iliac spine, and this is going to be the posterior inferior iliac spine. So there are four spines. Now this right here is the iliac crest, and this on the lateral view, this is the ala, the wings. Now we are then going to move down to the ischium. So this right here is the ischium. The ischium, we're still looking at it from the lateral view because you can see the acetabulum. The ischium has its own spine right here. This is called the ischial spine, and this bump is the ischial tuberosity, where all of the gluteus muscles are going to attach to. So the ischial spine serves as a divide between the two notches. This right here is the greater sciatic notch where all your sciatic nerves run through, and the one on the bottom is the lesser sciatic notch, and it's divided by the ischial spine. So greater sciatic notch and lesser sciatic notch. Now this is still the lateral view. We are now going to move into the pubic bone. The pubic bone, okay, again, this is our view right here, okay, and this is still the lateral view. The pubic bone is this area right here. There's a pubic symphysis where it's going to join with the other pubic bone. So with the pubic bone, the one on top is the superior ramus of the pubic bone, and the bone on the bottom is the inferior ramus of the pubic bone. So far we have been looking at the lateral view. I'm going to tilt this now so that we look at the medial view. So remember, this is how everything fits in like this. Before we were looking at it from the lateral view. Now we're going to move in to the medial view. Okay. Within the medial view, you can no longer see the acetabulum. The acetabulum is no longer present, but we still have the obturator foramen right here. This is still the ilium, this is the ischium, and this is the pubic bone. With the ilium, we still have the iliac crest, okay? And now this divot that you see on this side, this is the iliac fossa. So this concave surface, this is the iliac fossa. This portion right here is the body. The body is the area where all the three bones fuse. You can see the body on the medial and on the lateral view. Another thing to point out is that on the medial view, you can see this line that's going down here. This is the arcuate line. So this line right here is covered by the tape, but this is the arcuate line. The arcuate line is served as a landmark which separates the ilium from the two bones on the bottom. Okay. Now, this is the medial view. The anterior portion is here. The posterior portion is here. So this would be your anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, and posterior inferior iliac spine. This right here would be your ischial spine. This is the greater sciatic notch. This is the lesser sciatic notch. This is the obturator foramen. Again, this is the ischium, this is the pubic, and this is the ilium. Now, we studied the lateral and medial view on the left bone. You should be able to translate this information to the lateral and medial view of, this is the right bone. We studied the lateral and medial view of the right bone. You should transfer this information to the lateral and medial view of the left bone in your handout. All right, welcome back everyone. So now let's go over the femur bone. The femur is the longest bone that we have in our body. It's the principal bone of the thigh. So this right here is going to be the right femur in the anterior and posterior view. So make sure you understand how to differentiate between the right and the left femur, which view you're looking at. So in the anterior view of the femur, you can see right here that there is the patella surface that's very visible. It's not visible in the back so much. So this patella surface is going to tell you that this is the anterior view. And if the head of the femur is facing inwards to the right, then you're looking at the right femur, because you can see here that the head of the right femur articulates with the acetabulum of the os coxae bone. Now, on the left femur, in the anterior view, you would see the patella surface, but the head of the femur would be facing to the left side because it's going to articulate with the acetabulum of the left os coxae. So that's how you differentiate whether it's the left or right femur. So now let's just go ahead and examine the right femur. So in the anterior view, you can see that this is the head. The dome-shaped part is the head, and you can see the head from the posterior view as well. Now in the head, there is this divot. This divot on the head is called the fovea capitulus. So the fovea capitulus is the divot on the head of the femur where the round ligaments of the femur are actually attached to here. And then underneath the head, this area right here is the neck. So this is the neck of the femur. The neck of the femur is right here. Okay, so this is the neck and this is the neck. It sort of makes an angle with the main body of the femur. It sort of makes like this 25-degree angle with the shaft of the femur, and a lot of your weight from the trunk region of your body is supported right here and it's transmitted down the thigh. Now, on the top portion of the femur, you can see that there are two bumps. There's a bump here and a bump here. So a bump here and a bump here. Okay. So the bigger bump is called the greater trochanter. It's the bony prominence. It's the bigger bump, as you can see here and here. This is where all your glute muscles are going to attach to. And then the smaller bump is called the lesser trochanter. The smaller bump is going to be the site where the psoas major and iliacus, where they cross over and they form the um, iliopsoas muscle. It's going to attach to the lesser trochanter. So we haven't learned about these muscles yet, but I want to at least introduce you to the name of it, so when you see it again, it'll become familiarized to you. Now, if we take a look at the femur from the posterior view, there's a very strong line that's only visible in the posterior view. This is called the linea aspera. The linea aspera is found only in the posterior view, and this is where all your quadricep muscles are going to attach, in the linea aspera right here. Now, on the back of the of the of the femur, instead of having this smooth patella surface, which we see in the front, you're going to have these two notches that are more visible from the back. So the notch that you see here, okay, this is the medial condyle because it's facing the midline, and you can see you can only see the condyles from the back. So this is the medial condyle, and this right here would be therefore be the lateral condyle. Now you have the medial condyle and the lateral condyle. This is going to articulate with the condyle of your tibia to help flex and extend the knee joint, and we'll talk about the tibia bone later. Now, in addition to those condyle, there's going to be the epicondyle. The epicondyle, there's also the medial and the lateral epicondyle. So here on this surface, this is the medial epicondyle, and this is the medial epicondyle here. This would be the lateral epicondyle, and this would be the lateral epicondyle here. The epicondyle, the epicondyle is where the collateral ligaments are going to attach. Okay, and then actually going back to here, okay, the space in between the medial and the lateral condyle, this space is called the interclavicular notch. So the interclavicular notch is between the medial and the lateral condyle, and a lot of your ligaments are going to be attached here as well, such as your ACL, your PCL, which are the anterior cruciate ligament and the posterior cruciate ligament. And some of those ligaments are also attached to the medial and the lateral epicondyle as well. And on this side, this would be the medial, and this would be the lateral epicondyle. And then again, this is the patella surface where your patella, which is your kneecap bone, this is where they are going to attach. All right, so now moving down to the patella. So you can see right here, this is the patella surface of the femur, and this is the patella, which is your kneecap. Now here, we are looking at the right anterior kneecap. And also, let's see, there's a mistake here. This is still the right. Okay, so now moving back to this view. Okay, so what you see is that there's going to be the anterior and posterior view of the patella. The anterior view, it's not as smooth, but it's still bumpy, but it's somewhat more of a bumpier than compared to the posterior view. The posterior view, there's going to be a divot, while the anterior view, there's going to be like a raised surface. And with the patella, there's the base and there's the apex. The apex is actually pointing downwards, pointing inferiorly. So this is the apex right here of the right patella. So how you can differentiate whether you're looking at the right or left patella is first identify the anterior and the posterior view first. Okay, you got the anterior and then you got the posterior. If you flip it to the posterior view, you're going to see these two divots. The divots are called the facets. So the medial articular facets, this is going to be the one that is on the medial side, and it's also the smaller one. The lateral articular facet is going to be the larger facet, and it's going to be on the left side. So with that, if you know where the lateral and the medial is, okay, you can tell that the medial is always facing inwards. So if this is the medial view from the back side and you flip it to the front, this right here would be where the medial articulate faucet is, okay, and therefore this would be the right patella. Okay, so essentially that is how you can differentiate between the right and the left patella. And if you want to know more about this in detail, there are going to be the lateral condyle of the femur and the medial condyle of the femur. It's going to articulate with the medial and lateral articulate facet right here in the patella. Okay, so now moving on to the bones of the lower leg, which are the tibia and the fibula bone. So with the tibia and the fibula bone, understand that the tibia is always going to be in the medial and the fibula is always on the lateral. So if you just take a look at a bone and it's just showing you the anterior view from this angle, you can tell that this is the right side of the body, because the fibula is on the lateral side, while this would be the left side. You should also differentiate the anterior and the posterior view as well. So in the anterior view, you can see this bump right here. So this is also how you can differentiate. So if you see a bump, you know that you're looking at it from the anterior view. And if the fibula is on the lateral side, this is going to be your right leg. So this bump right here is called the tibia tuberosity. This is a very prominent area, and this is going to be the shin bone. So it's located just right below the kneecap, and this is where your patella tendon is going to attach. When you go to the doctor and they test for your reflex, they tap it right here in the patella tendon. And if everything's working normally, you should extend your knee a little bit as a reflex. So this is the tibial tuberosity. It serves as a landmark to help you identify the anterior portion of the tibia. Now, moving up here in the top part of the tibia bone, you have some surfaces that we're going to identify. Let's go through the condyle first. So the condyle, remember, is any rounded projection. You have a rounded portion right here and a rounded portion right here. The rounded portion here that's facing the midline, this is called the medial condyle. And then the lateral portion condyle is called the lateral condyle. So both of these rounded articular projection of the bone is going to serve as a smooth articulation and movement of the joint. Now, if you take a look at the surface here, you also have these two ridges that you see. The ridge that's closest to the medial condyle, that is called the medial intercondylar tubercle. And then the one that's facing the lateral side, this is called the lateral intercondylar tubule right here. And in between the medial and the lateral intercondylar tubule is going to be the intercondylar eminence. The intercondylar eminence is the bony ridge that's located between these lateral condyles, and it plays a crucial role in helping the knee have stability and function. It also serves as an attachment point for ligaments as well. Again, the ACL and the PCL, the cruciate ligaments. And because of that, it helps resist excessive movement, and it can also prevent injuries as well. So the intercondylar eminence right here. Okay, it's between the condyles, and it's also between the epicondyles as well. So again, this is the tibia tuberosity. Now we're going to move down into the tibia, and in the anterior view, you can see that there is also a divot that's protruding out. This is the anterior crest of the tibia. This is also known as the anterior border, but this prominent ridge on the front part of your shin bone serves as a primary attachment point for muscles, ligaments, anything deep fascia within the leg. And it starts, actually, the anterior crest starts from the bottom of the tibia tuberosity and it goes downwards here. So this is the anterior crest. And then at the very distal end of the tibia, you have the medial malleus. This is the medial malleus right here. Okay. There's also the lateral malleus, but the lateral malleus is going to be where the fibula is at. So you have the medial malleus on the medial side of the tibia, and the lateral malleus is going to be on the lateral side of the fibula, the other bone. So again, the malleus are both the bony protrusions at the lower ends of the tibia and the fibula respectively. They both help form the ankle joints. Again, the medial malleus is on the inner side of the ankle, and the lateral malleus is on the outer side. And they also help stabilize the joints as well. So moving to the fibula, we talked about the lateral malleolus already. The head of the fibula is right here, and this is going to attach to the tibia. And that is all for the tibia and the fibula. Let's go on and, another thing that I want to show as well. Let's go back to the top portion right here, because this may be a little bit confusing. From the superior view, if you're looking at it from a bird's eye view, you can see the condyles and the intercondyle more in detail. So this is the right knee that we're still looking at. This is the medial condyle right here, and the flat surface, the rounded surface, is very prominent if you're looking at it from a bird's eye view. And this would be the lateral condyle, and this is the lateral condyle right here. So these two ridges, the epicondyle as shown before, you have the medial, the intercondyle, you have the medial intercondycular tubercle here, which is this part, and then the lateral intercondycular tubule, and this would be this part. And then the space in between them, which is what I had the laser pointing right here, it's the intercondycular eminence. So hopefully this picture shows you a more better view. And then this bump right here, you can also see it from the bird eye view. This is the tibia tuberosity. And with that, let's go and see how the distal end of the tibia and the fibula articulate with your feet. Now in this diagram, this is looking at the superior view of the left and the right feet. So this is the left and the right feet. Okay. So we can go through the bones of the feet. Now, the bones of the feet are broken up into three groups: the tarsal, the metatarsals, and the phalanges. So the tarsals include all the bone right here. This is all of your tarsal bone. The biggest tarsal bone that you have is the talus. So this is the talus right here, and this is the talus right here. You could think of the tarsal bone as your ankle bone. Okay, so the talus is the slope. So it's this portion right here. This is the talus, and the calcaneus is right here. This would be the calcaneus. The calcaneus is the heel bone. So you got the talus, which is the hill, the slope, and then you have the calcaneus. This is your heel bone. Now this bone right here, which is still part of the tarsal, this bone right here is called the navicular, or the navicular. It means boat. Okay, navicular. And then on this side, this is the cuboid. So you got the navicular and the cuboid. You have the navicular and the cuboid. Then you also have three cuneiform bones. This is cuneiform, the medial one. This is the intermediate cuneiform, and this is the lateral cuneiform because it's going to the lateral side. On the right foot, you have the medial cuneiform, intermediate cuneiform, and lateral cuneiform. And this right here is the cuboid, and this again is the navicular. this is the talus, and this is the calcaneus, and all of these bones make up the bones of your tarsal, which is your ankle bone. And there are 7 bones in total. 1, 2, 3, 4, 5, 6, 7. 7 ankle bones. Then we move into the metatarsal. So the metatarsals are right next to the tarsals. This would be metatarsal 1, 2, 3, 4, and 5. So you start from the midline going out. So this would be metatarsals 1, 2, 3, 4, and 5 of your right foot. And then you have the phalanges. Okay, with the phalanges, there's going to be 3 groups of phalanges. You got the proximal, the middle, and the distal. So this is the proximal 1, 2, 3, 4, 5. And those are the proximal phalanges on the right foot. 1, 2, 3, 4, 5. Now with the middle, remember, because the toe is a little bit shorter, we're not going to have the middle phalangeals 1 for the toe. It starts off as number 2. So right here, this is the middle. So middle phalanges 2, 3, 4, and 5. And here, middle phalanges 2, 3, 4, and 5, none for the toes. For the distal, it goes back to number 1. You got the distal phalange 1, distal phalange 2, distal phalange 3, distal phalange 4, and 5. And then on the right side, you have distal phalange 1, 2, 3, 4, and 5. Okay, so the middle phalange is the unique one. It starts off as number 2. Number 1 is not there, so it just starts off with number 2. And this is the same for the hands as well, if you remember. And then you can see that the talus, this is showing you the right foot. It is going to articulate with the tibia, and then the fibula articulates with parts of the talus as well. Okay? And that concludes the appendicular skeleton.